Hello, I am Dr. Prahlad Rao from Mysore. Today I am going to talk a little bit about hypertension. Hypertension or blood pressure is the pressure exerted on the arterial wall. When the heart contracts, it is called systolic pressure, and the pressure when the heart relaxes is called diastolic pressure. The normal BP is should be less than 120 by 80 millimeter of mercury. Earlier, about 40 years ago, we used to check blood pressure for every patient after 50 years. But nowadays, we advise for the regular blood pressure checkup even at the age of 18, 20 because of the civilized, stressful life, food habits, and the nature of the work they do, lack of exercise, etc. etc. Normal blood pressure should be less than 120/80. Anything above 121, 81 up to 89, it is called first degree hypertension. Usually at this stage, we advise some lifestyle changes like salt intake reduction, cessation of smoking, and regular walking at least 40 minutes per day, and fruits and vegetables consumption, avoiding the processed food, etc. we advise. If the systolic is above 140 and diastolic is above 90, it is second degree hypertension and they require a little dose of antihypertensive medicines. If the systolic is more than 180 millimeter and diastolic more than 120, it is third degree hypertension or hypertensive emergency. Usually there are two types here, hypertensive urgency and hypertensive emergency. Hypertensive urgency is the BP is above 180 and 120 but without any end organ damages. If there is end organ damages along with the high BP, it is an emergency. There are two types of hypertension, primary hypertension and secondary hypertension. For primary hypertension, there will be no exact cause. Usually it is old age, obesity, sedentary life, lack of exercises, smoking and high salt intake. Here the symptoms are very less and it is called silent killer. In secondary hypertension, there is some amount of causes for that like kidney diseases, renal artery stenosis, less perfusion to the kidney because of the various reasons, and aldosteronism, atherosclerosis, vasculitis, aortic dissection, etc. Usually when we record the BP at our clinic, if it is high, immediately we will not start the treatment. We ask the patient to get frequent visits and record the BP in their house itself. Usually when they come to our office, it will be very high and it is called white coat effect. And some people will have high blood pressure during night. In such case, we do ambulatory blood pressure monitoring. When the patient is diagnosed to have hypertension, he advises so many tests like fasting blood sugar and average blood sugar for 3 months, that is HbA1c, lipid profile to know the level of LDL and HDL particularly, and even triglycerides, kidney function tests like urea, creatinine, uric acid, serum electrolytes, and estimated glomerular filtration rate, etc. and heart tests like echocardiogram and ECG. According to that, the doctor treats the hypertension. With this, I will conclude my speech. Thank you.